coasters. But in the meantime, let me go ahead and tell you a little bit about Paloma Health. So we are an online medical practice. We specialize in hypothyroidism and Hashimoto's, and truly, we look at the whole body approach. So the biggest thing that our providers, the thyroid is so complex, and there are so many different factors that impact our thyroid, and that's why stress, sleep, nutrition is a huge one. Gut dysfunction is a big factor in your thyroid health. And these are all factors that our providers, like Dr. Peña, you're going to hear from today, take into consideration when they create a treatment plan for you. As I mentioned, we are an online medical practice, so you can see us from the comfort of our own home virtually. You can book appointments with our providers. You can get medication refills. We have an awesome app that can help you track your symptoms. You have meal plans on there. You have workouts, guided meditations. I mean, we have so many blogs and resources and guides if you need help with understanding how genetically the thyroid works, from stress and sleep. All of these different guides are at your fingertips, both on our website as well as the app. We also have nutritionists on staff that you can see if you, let's say, have any sort of macro, micro vitamin deficiencies that can be addressed with, for example, a nutritional approach, especially when it comes to Hashimoto's. Bringing that inflammation down is key, and nutrition is always going to be is very much key. And nutrition is always going to be the first place that our providers and our nutritionists are going to want to work with you. So without further ado, I'll go ahead and pass the baton to Dr. Peña. But if you have any questions, feel free to enter them in our community. Leave them below. We'll get through as many questions as possible. It is a short segment. We only have about 30 minutes. So we're going to rapid fire do as many questions as possible. So without further ado, I'll go ahead and let Dr. Peña introduce herself to you guys, and then we'll go ahead and get started.
Rapid fire reminds me of listening to blog posts when they have at the end of rapid fire. We're going to answer these questions really quickly. Hi, I'm Dr. Teresa Peña, and I am a integrative functional medicine doc. I'm board certified in family practice, but left conventional world several years ago when I wasn't creating any really health with any of my patients. And over the last several years, really have kind of felt a heart for women's health, and within that, the thyroid care, because a lot of women have thyroid issues, but in the conventional world, their scope of thinking is not as broad as what I find to think and to get people feeling better, especially with the Hashimoto's. So I've been with Paloma, coming up on a year now, and it's been really a blast to work with people in their thyroid world, in getting them better and answering their needs and hearing, just being heard, which is part of healing. Let me see. So we're going to do rapid fires. We've got our first one here. How can I help my hair grow back and make it shinier? I feel like my hair is dull and dry. Well, so the context of that, my first thought is, how old are you? Because a postmenopausal woman is going to have different hair than a premenopausal woman. And then there's that third category with the transition between one and the other. And so what you can do is support your thyroid through particular supplements, and Paloma has a great one for that, but also your protein intake. Your protein intake is going to be really important because your hair is made of protein. So B vitamins in the thyroid support will help your hair, but also the right protein intake. But realize your hair is going to reflect about your last couple of months of what's going on in your life. So if you had a big stress, you were hospitalized, you were sick, you had a big upset, something, and your hair will actually fall out about 6 weeks later because of how the hair grows naturally and its natural cycle. So you can't, when I think of hair, I always think of the whole context of who is sitting in front of me, what's been going on in their life, what's the nutritional issues, and thyroid definitely has an impact on that. So hopefully that you got a tip or two. I take my meds at 6 o'clock every morning. Do hormones released by working out? have any effect on the absorption. I want to work out either right before or right after, but I don't want to throw my levels off since they got leveled. Great question. Interesting. So I don't know this because I don't think there's any research, but here's my thought experiment with that. So if you're taking your thyroid medication, empty stomach, no food for 1 hour, no calcium products or mineral products for 4, that you should be able to absorb your medications by the time, most of your medications by the time you start to work out, unless you're like me, you pop right down to the basement and start working out. The reality of working out is that your blood flow to your stomach and to your intestines gets shunted to your muscles. So your absorption may be slowed a little bit, but it shouldn't ultimately affect anything. So now that you're at great levels, then I would say work out, because that's great for the body, great for the mind, and great for your thyroid. So just continue that pattern. If that is your pattern, your body will compensate. And as you get tested, you'll find a new normal. So I wouldn't worry too much about it, but kudos for working out first thing in the morning. That can be hard. Let me see. My labs have been weird since switching to NP. Elevated TSH, but I feel slightly better and have more to slightly above average T3 and T4. Is that normal starting NP or armor? I would, if you're in the first few months, and by that I mean like 3-6 months and sometimes even longer, of switching from a synthetic like Levo or Synthroid to a natural desiccated, it can take several months for your whole system to recalibrate, because you are now giving your body some bioidentical T3 and T4. Now, the levothyroxine is completely synthetic, so your body has to take that and break it down, and then it has to fit in the receptors. And sometimes it doesn't fit in the receptors really well, and so the body gets a compensated a normal with this synthetic. Now it's got everything that fits just perfectly, and so it has to adjust things. I will tell you that when I adjust medications on thyroid, I typically test between 6 and 8 weeks later. 2 months, you're like, wow, 2 months? Yeah, because that's the time it takes to calibrate these hormones that are in a very narrow range between your pituitary, between your hypothalamus, down to your thyroid, down to the whole body. There's lots of control mechanisms in there, and everything has to get rebalanced. So hang in there. If you're feeling better on the NP or the armor, great. Your body likes it. We just have to find that new normal, and it's just taking a few months. So don't worry about it. Let's see. I stopped taking levothyroxine because I noticed no difference in how I feel. I then had my doctor draw labs, and she only took a free T3, normal range, free T4 at the low border, and a TSH is 6.548. Any suggestions? Well, again, needing a little more context about what else is going on. How are you feeling? What are your previous labs? Any complication? But based just on this information, I, for one, want to optimize thyroid. So there's kind of two camps, if you will, with TSH. One that says, look, you're not above 5 or you're not above 10. It's a little high. All your other normals are fine. We're just going to watch you. Okay. That's perfectly acceptable, again, with the appropriate context. But I like to go for optimization. I like to have the thyroid functioning as best as it could. And my thoughts are around 2, 2.5 or lower, sometimes below 1, depending on the person. So if I were looking at your labs, I would ask, what's going on? Again, context is everything. What else are you working on to optimize that thyroid? Nutrition, lifestyle, gut health, stress, all, and what's it been before, and then where are we going for? That isolation of numbers, my first thought is I probably need a replacement. And even though there's these things, are there antibodies? What else is going on? What's that reverse T3? So all of that in context, but I would actually look at, with those numbers, what else is going on? Because something else is going on, and there's a disconnect between the TSH and the free T3 and the free T4. Go check out your doctor, or come back to a Paloma doc and see if we can't optimize those things. All right. We are doing the rapid fire. If my TSH is 1.6, can I still be hypo if my cholesterol is high, despite a pagan diet and lots of exercise and no family history of high cholesterol? So you're connecting, if I'm reading this note right, a TSH with a high cholesterol. Classically, a high TSH or a low functioning thyroid can be connected to cholesterol levels. But if your TSH is fine and your cholesterol is still high, then I would not necessarily assume that those two have a direct connection. So I would have to look into actually, again, what else is going on with you. Um, and the pagan diet actually may not be the perfect diet for you. Genetically, there are people out there who do a low fat diet, and this is genetic. Low fat diet, those who do a low carb diet, and those who do better on the Mediterranean, just from genetics. So you may be falling into one of these things and you don't know. And so you may be eating opposite of your genetics and therefore an elevated cholesterol. Can you give me any insights to the correlation between gallbladders and hypothyroidism? Would not having a gallbladder make my hypo worse? Interesting connection. I don't see a direct, but I could be completely wrong, and I'll have to I'd have to ask that. That I am not sure about a direct connection. I haven't learned about a direct connection. Doesn't mean there's not. So, good question. I'm sorry I can't directly answer that. How often should I have thyroid labs checked while on a keto diet? How does keto usually affect thyroid numbers? Do I need to avoid all dairy if I don't feel like I'm having any problems with it? FYI, I have Hashimoto's. So, with Hashimoto's, it's all about the antibody numbers. So, what have your antibodies done on your keto diet? Are they stable? Have they gone down? That's a big thing. I personally would recommend staying away from dairy because so many people have intolerances to dairy. Notice I said intolerances, not allergies. So when we think about gut-based allergies to food, typically we're talking about intolerances, meaning the immune system has built-in immunity to a protein, to a dairy, to whatever. And so when you eat it, you get an immune response. An immune response causes inflammation or potentially even cross reactivity to the thyroid. And then the immune response starts to affect your thyroid. So I would just say, what are your antibodies level and what are they doing? And focus in on that and if it's working or not. Again, everybody's going to be a little bit different. Their gut is always going to be involved with thyroid, especially Hashimoto's. But what is your gut doing and how well is it functioning is a bigger question in my brain as I connect the things that connect to the thyroid. Have I ever known of a patient that was able to wean off meds completely? I'm unsure if I ever needed thyroid meds for hypothyroidism. Interesting. I believe I was slightly deficient in iodine and selenium. My new doctor has cut back on my dose by tenfold and still going lower over the past year. Ooh, very good. I actually have seen some thyroid labs with the TSH just a squeeze up, much like that 6 something above there, and have their free T3 and free T4 be kind of acceptable, but probably borderline, and then have low levels of thyroid antibodies. So what I really learned in the education I've had, especially within the naturopathic world, which is all about nutrition, is that when you have low levels, like in the 20s or 15s, and I do mean low, that hints of nutritional deficiencies, selenium and iodine. So it sounds like that might be your case, and you've actually corrected those, and your TSH is going back into a more happier level, and you may not need thyroid, or maybe very tiny doses. And so that nutritional aspect of the thyroid function is huge, 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 huge. Again, inflammation. If you're eating right and getting your gut healthy, inflammation goes down. That lets your thyroid work better. Your vitamin D may be going back into normal. Again, makes your thyroid better. So, yeah, I don't know that you had hypothyroidism, but you had labs consistent with it. So that probably might have been inappropriate, but you're doing some really great, awesome work on that nutritional lifestyle. Keep it up. All right. My antibody TPOs is over 1100, and my thyroid antibody is almost 200. Understanding numbers, these numbers are high, yes. My question is, could that be causing my hands to go numb at night? Sometimes I wake up with one or both hands numb. This is just now starting to happen. So those numbers are really high, and hopefully you're working with somebody to lower those antibodies and making sure that your thyroid if function is good, that the anatomy of it. So when I see really high numbers, I wonder about little tiny activities in the thyroid that can't be seen unless with an ultrasound or a study. So hopefully you've got all of that part covered. And could it be from your hands? If I didn't know your thyroid antibodies and you're laying on your back with your hands across your stomach, anatomically, it's very common for your hands to go numb. Now, I will tell you that carpal tunnel is connected to thyroid. So if you have thyroid issues, and you do, and your hands are going numb, you may have some carpal tunnel issues there. That can be checked out by your primary care doctor with an exam. And as your numbers go lower, that should help with the carpal tunnel if indeed that's what you have. So I would strongly encourage really working on lowering those antibodies through nutrition, through gut health. The AIP and the Paloma app is awesome for things like that. Making sure, again, nutrition, your selenium, your zinc, your vitamin D, all of those kinds of things are really on target. And because there's a lot of room for improvement, and it can be done. I've seen thyroid antibodies in the hundreds drop down to less than 10 from all nutritional interventions. And no gluten, by the way. Sorry, but no gluten, because that's a key trigger for a lot of this antibody stuff. What's the difference between thyroid peroxide antibody and thyroid globulin antibody test? Okay, so those are antibodies against two different proteins. So the thyroid peroxide antibody is a antibody against a protein that's an enzyme, and the enzyme sits in your thyroid. So in essence, the thyroid, that particular TPO, is working on your thyroid gland itself. The thyroid globulin is actually the protein where your thyroid starts to get carried around. The hormones start to get carried around. If you have less of that, that's going to disturb the normal balances of things. And it again, will affect the thyroid function and gives us insight on how much autoimmunity is going on with your thyroid, how much of the antibody burden that your body has is directly affecting the function of your thyroid. And so those are two numbers I do like to get to give an idea. I've seen one be hardly there and the other one be in the hundreds, and vice versa. And they both can be elevated. And that just gives me a bigger picture of, again, that auto antibody load that's going on. Currently, we're going through a medication dosage adjustment, and I'm not bouncing back with energy like I usually do. 10 days with my new dosage, and I still have zero energy. I'm so tired of being tired. I can only imagine. About how long do you consider I should be patient for this new dose to kick in? And it depends on the dose. It depends on the medication. Sorry. So when I'm switching somebody from a synthetic levosynthroid to desiccated Armor and P, that drop in energy, that's significant. I look for it in the first 5-7 days. If it is, then the body needs some more. So there is not a direct adjustment from synthetic to the desiccated. Oftentimes it's an educated guess. And when the body starts to get bioidentical hormones, it's almost like sometimes the body is this dried sponge and you're giving it water, and the sponge just kind of sucks it all up. That can happen when we switch it over. So if you've been switched to a synthetic to a desiccated in that short amount of time, within 10 days, your energy just tanked and just stayed tanked, I would be looking at adjusting and increasing your medication. If it's from the synthetic to a synthetic, that takes longer. It's tough. I'm sorry, but it does take longer and can take about 2 weeks. But you're in close to that time. My suggestion is to reach out to your provider. let them know that your energy is really bad, and can they just do something? What can they do for you? Again, nutrition, making sure your thyroid has all the things it needs to make it work its best. Because if it doesn't, you're climbing up a steep hill, and all the doses adjustments will only work so much. But you got to have inherently that thyroid as a happy metabolic state to begin with. My TPO antibodies are high, 1700. TSH is high, but T3 and T4 are normal. Any insight to start or supplements? Well, number one, we're going to go back to gut health, nutrition. Number two is nutrition. So, and number three are different options when those antibodies are really high. So, first is the gut. If you have dysbiosis, some other things going on in your gut, you have food allergies, food intolerances, that will interfere with your thyroid function. It will create more antibodies, more immune burden, and so your thyroid's not going to work. Again, your goal is to get those antibodies down. Lifestyle is huge here. So in the gut, I also think about the nervous system. What is your sleep doing? What is your stress? Those kinds of things, because anything that affects your brain and your nervous system is going to immediately affect your gut. They are linked. The gut is often called the second brain. Nutritionally, again, as if you've listened into this time, I am talking about selenium. I'm talking about vitamin D and iodine, all those micronutrients that the thyroid needs to function well. It also does not need inflammation. It does not need toxins and like excess of those kinds of things that make it work less. So so I would be looking at the gut. Sorry, I lost my train of thought. The nutrition aspect, and then there's the whole what do you do after those have been exhausted, and there are options there. Again, getting with your provider, and if you've done all that work and your numbers are still high, there's still some things out there that can help you feel better. Because in my experience, when antibodies are that high, even though the T3, T3, T4 are in normal range, they often still feel like they're low thyroid. There are options out there. Let's see, I already have a goiter to begin with, but sometimes it swells up more out of nowhere. I'm not sure why this happens, but I want to ask, is this common and why? What can I do to reduce it? So the thyroid, okay, so the thyroid's a little big. My first thought is that because it has a nodule, or is it just generally kind of big on its own? If it's nodule, that is a different pathway for resolution and treatment. So if that's indeed getting with your doctor and pursuing that path. If it's just a general, just a thyroid that's sort of all over, a little bit bigger, my first thought is nutritional deficiencies. I live in an area in Minnesota where we're iodine deficient. So we used to have goiters all the time. And the US had goiters all the time. They put iodine in the salt for a reason. And so, yes, you need the iodine for this. And oftentimes you need those selenium and zinc type of things. So nutritionally, there are definitely things you can do. Intermittently, why it goes off, that would be something I would bring to your provider, because if you have episodes of hyperthyroid or inflammation to your thyroid, then I would be worried about what does that mean. And so when it goes up, when it feels inflamed, when it feels bigger, that's the time to connect with your provider to say, hey, something's going on with my thyroid. It's kind of funky. Can we do some testing? That's my thoughts there. Have you had Hashimoto's but hyperthyroidism at the same time? My labs indicate hyper. So initially, Hashimoto's can present with hyperthyroidism because you are attacking the thyroid, and the thyroid is releasing all of this hormones. So yes, definitely. And the pattern of Hashis is oftentimes a hyperthyroid, and it basically burns out the thyroid until it doesn't have any more tissue to release the hormones, and then you go hypothyroidism. Hyperthyroidism is a very different beast than low functioning thyroid. The complications and the worries and the monitoring is much more intense in a hyper than a low functioning. So hopefully you are in with a fabulous doctor who will monitor those things and offer you treatment plans for that. Let's see. I have markedly elevated thyroid antibodies, but the rest of my labs level off on the lower end of normal. I feel like having a higher T3 level would help me. So it's still possible for me to get a T3 even though my level's on the lower end of normal. Absolutely. So when a Hashimoto's patient is sitting in front of me and they're not feeling good, the two things I look at is, yeah, I want to look at their labs, but their free T3 kind of want it in the middle of the ranges. And then I want to know their antibody level because their antibody level is going to be the biggest lever that I can use to help someone feel better, feel less hypothyroid, as if not completely resolve it. And that takes all the things we've been talking about. It's the gut health, it's the nutrition, it's the stress, it's the sleep, it's all of those things. So I know we want to look at a number and go, just give me extra T3. That'll answer all of that. Unfortunately, I wish it was that simple, but it's not that simple because the thyroid is interconnected with all these other hormones and it has at a minimum two negative feedback loops. So the pituitary goes to the thyroid goes to the body goes back to the brain, and the brain actually goes back to the hypothalamus. So this is not a simple system. And when you start to add in particular hormones, it's going to recalibrate all of the hormones, all of the glands. But is it going to calibrate it to the point that you want? Probably not. That's been my experience. So I will work on things and recommend that we work on things that make the biggest difference, and then just see how things go. No hard answer for that one, but a lot of, well, we need to work on that. Sorry. Also looking for a meal plan. I'm having trouble getting enough protein. I was a vegetarian for 10 years and recently started adding fish, but would rather not eat animals and beans and have been troublesome for me lately. Gluten-free, dairy-free helps a lot. Yes, gluten-free, dairy-free helps a lot. Thank you for saying that. And let's see. Getting enough protein can be challenging. If you're going to limit yourself to the protein of fish, great, wonderful. You're getting some good animal protein in. I would look to supplement that with a shake. You can get pea protein shakes, so they don't have the problems with eating beans. And so some people just don't digest them well. But adding a good pea protein, you can also get protein shakes that are from egg and egg whites if you don't have an egg intolerance. So there are ways to do that, but I really love the idea that you are adding more protein. Most women do not get enough protein, and we need about 100 to 120 a day, which can be challenging to get, but it can make such a difference on how you feel and how your body functions. That was our last question. Alex, do I have that right?
Yes, thank you. My camera just decided to work finally. Yes, that was our last question of the day. Believe it or not, we ran through 30 minutes. So many questions. We had a few more that we didn't get to touch on, but
Okay.
if we didn't get to answer your question, please go ahead and just ping us in the community and we can go ahead and make sure to point you in the right direction when it comes to any sort of resources or anything. As I mentioned before, Dr. Peña is one of our awesome providers. So if you loved everything she had to say, or if you're like, I really want to work with her, you can book an appointment based on your state and location. You can go ahead and go to our website at palomahealth.com, book an appointment with her. And again, as she mentioned, nutrition, supplements, and everything is so key when it comes to your just overall thyroid health, bringing down that inflammation. We have so many different resources and guides available to you all, both on the app, on our website, and then also our providers, our nutritionists on staff can always point you in the right direction as well, especially if you need specific guided support for specific deficiencies or whatever the case may be for your personal treatment case. So yeah, that's it, guys. That's our June office hours. Thank you so much for attending. Dr. Peña, you were amazing.
Thanks, guys.
Thank you so much. Yeah, you simplified all the most complex questions. Thank you so much for answering. And we do have office hours every single month. So, make sure you're tuned in to our newsletter. You join us on our community. We announce them there always. And every month we have office hours with people like Dr. Peña who just, answer questions, whatever you have. It's your chance to, talk to our